If I may say, I do have very fond memories of having you as our chemistry teacher in school and now connecting with you after 20 years. Speaking about my journey, it actually started very simply with imagine there is a new cervical cancer screening test. So, clinical trials are like the testing phase of a new idea. We ask questions like, does this new screening method actually detect disease early?
Some careers begin in classrooms, some begin in childhood dreams, and some begin with a quiet, persistent question: is there more I can do with what I love? And for so many young minds, that love begins with biology, a subject that reveals the magic, mystery, and meaning of life itself. Biology is the science of life, but for many students, it becomes the science of pressure, expectations, and a single narrow path. Every year, millions choose biology, yet only a fraction of them enter medical colleges. Does that mean the rest are lost? Does it mean their passion ends there? Absolutely not. Not on my show, and certainly not in the real world. Hello, and welcome to the Vanya Career Show, where we are challenging the one size fits all myth surrounding biology careers and explore real global high impact opportunities beyond MBBS. I'm your host, Sunita Rai, founder of Vanya Career Consultancy, and today we are spotlighting a career direction that offers science, travel, real world impact, and absolutely no compulsion to become a doctor. And to guide us, we have someone who has mastered this space at a world class level. She began as a microbiology student, grew into a clinical research specialist, earned her PhD in epidemiology, and today works as a senior research scientist at the Heidelberg Institute of Global Health, Germany, leading economic evaluations for cervical cancer programs in Cambodia, a research that influences national health decisions. She's brilliant, she's inspiring, and she's here to open your minds to what's truly possible. Please welcome Dr. Kavita Singh. Kavita, it's truly a pleasure to have you on the show. Your journey crosses continents, disciplines, and deeply meaningful areas of science, and it gives students a completely new lens through which to view their own futures.
Thank you so much, ma'am, for your kind introduction. It's absolutely my pleasure, privilege, and honor to be here with you and doing this podcast. If I may say, I do have very fond memories of having you as our chemistry teacher in school and now connecting with you after 20 years. It feels so amazing. And let me also take this opportunity to say a huge thank you to you for giving us strong foundations in basic sciences. Thank you so much.
Thank you, Kavita. Let's begin right at the start of your story. What shaped your journey into microbiology, clinical research, and ultimately public health and economic evaluation? When did this interdisciplinary path truly begin for you?
Speaking about my journey, it actually started very simply with curiosity. I loved biology in school, especially the invisible world of microbes, bacteria, and viruses that fascinated me. And that is why I chose to study bachelor's in microbiology at University of Delhi in India. At that stage, I only knew two things. First, I liked asking why, and second, I didn't necessarily see myself in an operation theater. During my bachelor's, I also realized I was less interested in memorizing facts and more excited by questions like, why do some patients respond to a drug and others don't? Why do we know a vaccine is safe? And how do we decide which health programs are worth investing in? Those questions led me to study clinical research. And so I did master's in clinical research from Cranfield University and also obtained additional training in economic evaluation from London School of Hygiene and Tropical Medicine in UK, which opened this new world to me where biology meets statistics, ethics, and economics. And so professionally, I started working on clinical trials at Center for Chronic Disease Control in New Delhi. And slowly I saw this bigger picture that it is not just about testing whether a drug is working, whether it's effective or not. It's also about whether patients can access it whether our health system can afford it, and whether it's implemented well. And that is how I then moved into public health and epidemiology, and later deeper into health economics and implementation science. Today, as a research scientist at the Heidelberg Institute of Global Health, I work at this crossroads of understanding diseases, testing interventions, and figuring out how to make new health interventions affordable and scalable in real world settings. So, my career wasn't just one big jump, it was many small decisions guided by one bigger question where I can use my love for biology to improve people's lives at scale.
Beautifully shared, Kavita. You've just shown students that a career doesn't have to be linear to be powerful. Sometimes the most meaningful paths are the ones we grow into step by step. And speaking of growing into paths, many students hear certain scientific terms but never quite understand what they really mean. We often hear terms like clinical trials, public health, and epidemiology, but they sound quite technical to students. Can you break down what these really involve with a real world example from your work?
Happy to do so. Let me try to simplify it with a story. Imagine there is a new cervical cancer screening test. So, clinical trials are like the testing phase of a new idea. We ask questions like, does this new screening method actually detect disease early? Is it safe? Is it better than what we already have? To answer those questions, we recruit eligible women for screening. We follow a standard protocol, we collect data at baseline, endline, and then we compare the findings between the new test and the existing test to see which is more effective. Epidemiology is the detective work where we ask questions like how many women in this country get cervical cancer, at what age, and in which regions. So, what is the geographic spread of this disease? What are the risk factors? So, as an epidemiologist, we use data from populations to see patterns and causes, not just one patient at a time in a hospital. Public health, on the other hand, is where it all comes together to protect communities at the large. So, public health asks questions like how do we take the screening test, which is proven to be effective in a research, to real clinics? How do we train health workers? How do we reach rural women and ensure follow up treatment? So, in my current work, for example, we evaluated a cervical cancer screening program in Cambodia. So, the epidemiology helps us understand who is at risk or who is most at risk and where to focus. Clinical research ensures that the tests we are using work well, and public health is about making sure the program fits the local context, reaches women who need it most, and can be sustained. So, in short, I would say clinical trials test new intervention. Epidemiology helps understand the disease burden and risk factors, and public health makes sure that solutions actually reach people who need it the most.
That was such a clear, relatable explanation. You have made three big words feel understandable, almost human. Students will really appreciate that. And once these fields start making sense, the question becomes what roles can I actually pursue? You have specialized in multiple areas microbiology, clinical trials, economic evaluations, etc. What kind of career roles can young professionals pursue if they venture into interdisciplinarily health sciences?
Thank you, ma'am, for asking that question. There are so many exciting roles beyond the typical doctor label. A few examples include, for example, I started my own professional career with being a clinical research associate or project coordinator. So, as a clinical research associate or project coordinator, you manage clinical trials, working very closely with hospitals, doctors, and patients to ensure these studies run smoothly and ethically. Second, again, as an epidemiologist or data scientist, you analyze health data to track disease patterns, evaluate programs, to guide policy decisions. Third, you can work as health economist. So you can answer questions like, okay, we have limited resources or money. Which health intervention give the best value? So we help government and organization prioritize the most cost-effective intervention. Fourth, with training in public health, you can work as public health program manager, where you design, implement, and monitor health programs. For example, a national vaccination drive or a screening program for hypertension or diabetes. Fifth, you can work as an implementation scientist, where you study how to make proven interventions work in real world settings. So, why does a great idea on paper fail in practice? So, as an implementation scientist, you try to fix that. Sixth, you can also work as a policy analyst or technical advisor, where you work closely with governments or international agencies like World Health Organization, advising on guidelines, strategies, and health reforms. And lastly, there are a lot of opportunities and roles in industry, pharma companies, CROs, which is clinical research organizations, NGOs, foundations, those who are working on trials, access programs, and health innovation. The beautiful thing is, with a very strong foundation in biology, you can move into research, data, policy, management, or economics, depending on what excites you.
That's such an exciting range of possibilities, Kavita. Careers in science can truly be global and diverse, not confined to one room or one role. I'm sure students are thinking, I didn't even know these jobs existed. Now, here's the tricky part. When students hear so many options, confusion can actually grow. So, let's create clarity where it's needed most. If a biology student is curious but confused, how would you explain the difference between careers in public health, clinical research, epidemiology, and health economics?
Sure, let's imagine there are four friends at a party and all working on the same health problem, let's say diabetes. So, clinical research is the friend who says, let's test a new drug or lifestyle program and see if it helps patients. So, those who are working in clinical research, they work with real patients, they follow protocols and generate new evidence, robust evidence to see whether a drug is working or whether a lifestyle program is more effective for controlling diabetes. Epidemiology is the friend with the graphs and maps. So people who work as an epidemiologist, they look into the disease burden and the specific groups where diabetes is rising, in which age group, in which districts, and what are the risk factors. So they zoom out to the population level, not individuals. Public health is the organizer, They look into questions like, how do we prevent diabetes in the first place? How do we scale screening, counseling, or treatment across the country? So people working in the public health, they deal with systems, policies, and communities. Health economics is the one holding the calculator, I would say. So they look into things like, okay, we cannot do everything at once. So which interventions or which policies or strategies gives the maximum health benefit for the money we have? And all four are actually working toward better health for people. But clinical research asks questions like, does it work? Epidemiology asks the question, who is affected and why? And public health asks the question, how do we reach everyone? And then health economics is asking the question like, can we afford it? And is it worth compared to other needs?
Wonderfully explained, Kavita. Almost like you painted a map for students. Each field has its own rhythm and purpose. The way you positioned each field, almost like different personalities, makes it so much easier for students to see where they might fit. This is the kind of clarity they wish they had. Now let's go beyond the familiar path into the lesser known but incredibly impactful ones. What are some cool, lesser known roles in global health that you wish more students knew about?
I love this question because some of the coolest roles are the least visible, but they have now become super relevant. For example, monitoring and evaluation specialist. These are like the health project detectives. They track whether programs are actually achieving their goals and why or why not, based on a set of predefined indicators or project metrics. Second, global health communicator or science communicator. So these are people or experts who translate complex research into clear messages for the public, policymakers, and media. And in this age of or era of misinformation, this is a superpower. Third, implementation advisor or behavioral scientist. These are people or experts who study why people don't follow health advice and how to change behaviors through nudges, community engagement, and smart design. Fourth, as a health technology and in digital health roles, where people work from designing apps for telemedicine to building data dashboards for government, and particularly the space of tech and health is a huge and growing space. Lastly, as research manager or grants manager, these are people who help design studies, manage collaborations across countries, and ensure funding is used well. So these roles may not always be on Instagram or social media, but they have a massive ripple effect on health systems and policies.
Absolutely. Those lesser known roles often have a huge ripple effect. Students just need exposure to see them as real options. So, for those inspired to explore these paths, let's talk about what they need to build, starting with mindset and skills. From your experience, what are the foundational skills or mindsets students need to build if they want to enter the field of clinical research or epidemiology? Or what are some skill sets students often underestimate but are carefully game changers in global health?
From what I have seen, there are three big pillars. First, there's nothing like curiosity and critical thinking. So I would advise to be the person who asks questions like, "But how do we know this?" Or what does the data really say? That mindset and critical thinking is priceless in research. Second, comfort with data. You don't have to be a math genius, but you should be comfortable with numbers, basic statistics, and simple tools like Excel, R, or Python, because we know data is the language of scientific evidence. Third, communication and collaboration, because we know global health is never a solo sport. It's a team sport. It's a team science. As a researcher, as epidemiologist, we work very closely with nurses, doctors, community workers, policymakers, economists, sometimes even engineers and designers. So being able to listen, respect other perspectives, and explain your ideas clearly is a game changer. Some of the underestimated skills, but super important and relevant, include writing. Good scientific and proposal writing can literally bring funding and partnerships. Second, humility and openness. You might be the expert, subject matter expert in one field, but local communities are the experts of their own realities. So one needs to be humble and open to the diverse stakeholders with whom you work. And lastly, resilience. We know in the research world, we face a lot of rejections. Research papers get rejected, projects get delayed, grants get rejected. So the ability to bounce back quietly is a super skill.
That's such valuable advice, especially your point about curiosity and collaboration being just as important as technical know how. Soft skills and analytical thinking together make you a global health change maker. We glorify degrees, exams, and marks, but the skills you mentioned is curiosity, empathy, communication, critical thinking. These are the actual superpowers of the future. And now let's bring all this learning into a real world context through your work in Cambodia. You are currently working on a cervical cancer screening project in Cambodia. Can you tell us about how your role makes a real world impact, especially in low sources settings?
Yes. So this project in Cambodia is very, very close to my heart. In Cambodia, like in many low resource settings, cervical cancer is a leading cause of cancer deaths among women, often because it's detected too late. However, we know cervical cancer is largely preventable with screening. So our project in Cambodia focuses on screening women early, using tests that are feasible in that context and linking them to timely treatment. My role there is mainly in economic evaluation, where we compare the cost effectiveness or value for money for the new strategy, which we are testing, which is a community based self sampling for cervical cancer screening compared to hospital based traditional VIA approach. which is VIA is the visual inspection with acetic acid. So in the project, we calculated the overall costs for the health system to deliver the screening program and for women themselves, including travel time, lost wages. We also estimated the health outcomes like how many cancer cases can be prevented or deaths averted with this new screening program. Then we asked which approach between the two, the new screening program, which is community based self sampling, compared to the hospital based screening, gives the best health impact for the resources available, and which program is realistic to scale across the country. So the real world impact is when, a woman in a rural area who might never have been screened in her life now gets tested. The health ministry can use our evidence on cost effectiveness to plan national program and allocate budgets. For me personally, the most rewarding part is knowing that our spreadsheet and models are not just numbers. They translate into women living longer, healthier lives.
That's so inspiring. It's incredible to see how health research can truly empower communities, especially in under resourced regions. That's incredibly moving, Kavita. It's a reminder that research is not just numbers, it's dignity, access, and better lives for real people. Your work shows that you don't need a stethoscope to save lives. Sometimes you just need data, strategy, and a deep sense of responsibility. But of course, impact isn't created in isolation. It happens in cultures, communities, and contexts. So let's talk about that learning curve. You have worked in places like India and Cambodia while based in Germany. How important is cultural sensitivity when doing international health research? Any moment that really taught you this?
Cultural sensitivity is absolutely essential. You can have the best scientific plan, but if it doesn't respect local beliefs, customs, or communication styles, it will fail. One moment that stayed with me was during community engagement activities around cervical cancer screening. We realized that talking directly about cancer or sexual health in mixed groups was uncomfortable for many women, and some terms we used in English, like dual stain, HPV testing, it didn't translate well into the local language or it carried different connotations. So we adapted. We worked with local health workers. In Cambodia, the community health workers are called VSHG, Village Support Health Group. It's not a group of people, it's basically one lady, women, or health worker. We also engaged with community leaders to find language and analogies that felt respectful and understandable. We adjusted all the time how and where information was shared. For example, we conducted more women only sessions and we provided more time for questions. That experience reminded me that good research is not just about scientific accuracy, it's also about cultural respect. When communities feel heard and respected, they trust the process, and that is when real impact happens.
That insight is so important. Global health isn't just about science, it's about people, trust, and deep listening. And now, let's talk about the human side of research resilience. Research work can sometimes be slow and uncertain. What kept you going when results took time or when projects faced hurdles?
I can truly sense that, research can be very humbling. Timelines often stretch, data doesn't behave the way you expected, research papers come back with tough reviews. So, what keeps me going is number one, the why behind the work. I often remind myself of the women, families, and communities who ultimately benefit from better evidence and better programs. Second, focusing on small wins and celebrating those moments, like a good field visit, a data set which is finally cleaned, a student whom I'm supervising who is learning something new, a policy meeting, a dissemination event where your evidence is appreciated. These small moments literally add up. And thirdly, support system. having colleagues, mentors, and friends who understand that setbacks are normal in research. So we keep encouraging each other to keep going, and I'm extremely fortunate to have strong support system of my family, mentors who understand about the intricacies of research world. I've learned to see failures or delays not as, okay, I'm not good enough, but as a part of the process. If I really, and which I do, if I care about the questions that I'm trying to answer, I always find the energy to keep showing up.
I love that perspective. Patience and perseverance are often the unsung heroes of scientific work. And now, time for something fun and fast, our Mythbuster round. I'll name a popular belief about healthcare careers and you will tell us true or false and why. My first question is, only doctors save lives. Researchers just watch from the sidelines. True or false?
Allow me to say false. Doctors do save lives, one patient at a time. As researchers and public health professionals, they save lives by thousands through vaccines, policies, programs, and guidelines. And I would say both are essential teammates.
If you're not good at maths or coding, forget about clinical research. Myth or reality?
That's a myth. You need to be comfortable with numbers, but not a maths prodigy. You can learn statistics step by step. And, curiosity, discipline, and having good mentors matter more than being a born genius at maths.
Very well said. I think many students will really embrace this field now because you have done away with their fear of maths. Global health is equal to foreign university plus foreign passport. Sounds fancy, but how true is it?
Would say not true. Global health is about global problems and local solutions. So you can contribute from India, Cambodia, Africa, anywhere, working with local NGOs, governments, or international collaborations. I understand and agree a foreign degree can help enhance your training and skills, but it's not the only path.
MBBS nahi kiya, then you're just settling for plan B, a classic myth or a truth bomb coming.
That's a big myth, I would say. Clinical research, epidemiology, public health, and health economics are all Plan A careers in their own right. From my own experience, I've seen they require just as much rigor and their impact is enormous. So you're not settling, you're choosing a different and equally powerful route.
Women don't lead in health economics. It's a number game for men. Bias alert, true or false?
That's a false, I would say. There are many brilliant women leaders in health economics and global health financing. Numbers don't have a gender. What matters is your interest and perseverance. And from my personal experience, I've known several women scientists and health economists who are leading the field. I know Professor Kara Hansen, who is the current president of International Health Economics Association. I know Professor Alexandra Torbica, who is the current president of European Health Economics Association. So I would say there are many brilliant women leaders in health economics, and it's not a numbers game for men.
Public health careers are only for those who want to work with government agencies. Myth or reality?
That's also a myth. There are many public health professionals who work in NGOs. Like I also started my career with Center for Chronic Disease Control in New Delhi, which is an NGO. So you work not only with governments, you can work with UN agencies, academia, startups, consulting firms, the private sector, not just government.
Girls don't usually opt for data or health economics. It's a male dominated zone. Old myth or still true?
That's an outdated myth, I would say. Now we see more and more women are entering data science, biostatistics, health economics. At CCDC, where I worked for more than 10 years, the head of biostatistics is a female scientist, Dr. Dimple Condon. So I would say if you enjoy it, please take up space there. Your perspective is needed.
Research means sitting alone in a lab with no social life. Is that the reality?
That's definitely false. Yes, there are quiet days with your laptop or in your research, but research also means field work, team meetings, conferences, teaching, collaborations across countries. and a lot of chai pe charcha, I would say, and discussions that happens.
Kavita, that was fantastic. And you have not just busted myths, you have set students free from so many limiting beliefs. Now that misconceptions are out of the way, let's talk about real challenges and how you handle them. What were some of the biggest challenges you faced while transitioning across fields, and how did you overcome them?
Transitioning across fields, it sounds exciting on paper, but in real life, it comes with doubts. And I've also experienced that myself, asking questions like, am I starting from zero again? Will people take me seriously? For example, when I moved from microbiology into clinical research and later into epidemiology and health economics, I did experience steep learning curves, new terminology, new methods, new software, but I also felt this imposter syndrome, feeling like everyone else belongs here more than I do. But what helped me was continuous learning. I took short courses, asked silly questions, and allowed myself to be a beginner again. Second, having mentors. These were people who believed in my potential, and even when I doubted and gave my courage. I'm truly blessed to have amazing mentors in my life, including Professor Prabhakaran, who is the director of CCDC, Professor Nikhil Tandon, who is the professor and head of Department of endocrinology and metabolism at AIMS New Delhi, Professor Mark Huffman, who is a cardiologist at Washington University in the US, and my current mentor, Professor Manuela Dialicari, who is the head of Health Economics and Financing Unit at Heidelberg Institute of Global Health. So having mentors and interdisciplinary mentors have also really shaped my research career. And lastly, connecting the dots. So instead of seeing my shifts as unrelated, I saw them as layers. Like microbiology gave me strong scientific grounding. Clinical research taught me evidence generation, and epidemiology and economics gave me tools to work at population level. So now I see these transitions not as failure, but as evolution process and refining where you can contribute best.
That is such an honest, empowering message. Students need to hear that growth often requires courage and discomfort. And before we wrap up, let's give students something actionable to start with. Can you share three tools or platforms like website, courses, or communities that students interested in public health should definitely explore?
Yeah, happy to share. I would like to share a few that are accessible and widely used. First, course platforms like Coursera, edX, these are called MOOCs, massive open online courses. So I would suggest to look for introductory courses in public health, epidemiology, global health, and health economics from top universities like Johns Hopkins, London School of Hygiene and Tropical Medicine, and others, Harvard University. These are very great to taste a subject before committing. Second, I would advise to visit global health websites, including WHO. The World Health Organization website has a lot of open access reports, guidelines, even basic training modules, and it's a great way to understand real world health priorities. Thirdly, being part of professional and student communities. Many global health networks and student groups exist on LinkedIn, to universities and NGOs. So, following organizations who are currently working in public health, implementation science, and health economics can give a nice exposure to you, and you may attend webinars, may follow internships or fellowship opportunities. So my suggestion would be to start small, taking one course, reading one report, attending one webinar, and over time you will get much clearer picture of whether this space excites you.
What a fantastic starter kit. These are practical, doable, and exactly the kind of resources students need to test the waters before jumping in. And with that, Kavita, we have arrived at the end of a truly eye opening conversation. Kavita, thank you not just for the knowledge, but for the hope and confidence you have given to every student watching. You showed us that biology isn't a narrow road leading only to MBBS. It's an entire landscape of global careers, meaningful impact, and scientific adventure. Your journey is a true reflection of what we stand for at the Vanya Career Show. Its success is not about following the crowd, but about discovering your own direction, one decision at a time. To all the watching, if you love biology but you feel unsure about MBBS, let today be your reminder. Your path can be bigger, broader, beautifully your own.
Thank you so much for this beautiful and nice opportunity to share my experience. I'm really grateful to you. Thank you so much.
If you need clarity, guidance, or a personalized career plan, visit www.vanyacareer.com or follow us on Instagram and YouTube. This is the Vanya Career Show, and I'm Sunita Rai. And as always, I'm here to help you discover careers that fit you, not the crowd. Remember, the world is bigger than your plan A, and your future is bigger than your fears. See you in the next episode of Vanya Career Show, where your future begins with the right guidance.